My name is Dr. Dayo Adeyanju from Nigeria, former Commissioner for Health in Ondo State and now Executive Director for Guaranteed Healthcare Foundation. The policymakers are keen to learn from one another, perhaps because they've got some challenges, that they're trying to overcome. And so they need somebody to help them out to improve, on their own system and see how they can do things better, or sometimes as a result of the born out of passion, to provide exceptional qualitative services, you can then seek how best this can be done. Well, sometimes they don't want to learn from one another for sake of trying to create your own niche, first and foremost, out of ego. And the other thing has to do with the fact that for differences in politics or for differences in geographical backgrounds, or you think that the experience over there might not sit into your own system or might not work in the system. So you might want to say, well, there's no point going to learn, what you think you don't need. Oftentimes people want to go ahead and learn what they think they need and will be useful to them. I worked as Commissioner for Health and I was engaged in great reform to see how we can drastically reduce the high maternal mortality that we met while coming into office. It was as high as about 745 per 100,000 live birth, which was quite high, in fact worse than the national average. And this was recognized then by the World Bank. And of course, it was important that we put in a reform to see how we drastically could reduce that. And what did we do? What we did was to first do a baseline, and it was clear that why were the women dying? And they were dying because 16% of those who will come to your facility to do antenatal registration, go through your clinic, will eventually come back to deliver there, meaning 84% has gone elsewhere. So it became imperative that we now look at strategy to track them back to facility to ensure that skilled hands take the delivery, because at the traditional birth attendant, mission home attendant, or self-delivery, you cannot ascertain the skill. And anything could go wrong. That's why the women were dying in those homes. So the strategy we put in place then was to now register all these pregnant women and ensure that there is an assigned health ranger who are community health extension workers to track them, and make sure that they come back to facility at the critical moment when they're about to deliver. And within 1 year, of piloting the program, we only had one unfortunate maternal mortality, which we recorded. And when you extrapolate that, we were able to crash maternal mortality to 317 from 745 per 100,000 live births. So it was clear to us, that this program is truly working. But then we looked at why were the women still dying? Where were they dying? And then it was revealed to us that they were dying at a traditional birth attendant's place. And so we had to enter into partnership with this traditional birth attendant. And what was more was that we said, you're no longer going to be able to take delivery. You refer your patient to us. But when you do that, we then issue you a coupon. And you then redeem this coupon when the woman eventually delivers. And that will keep you, remunerated, even though you are not doing much other than the referral. And of course, that way, we were able to further crash the maternal mortality, down to around 161 before we left office in 2016. 80% reduction in maternal mortality. And so our vision of ensuring that pregnancy wasn't a death sentence, was actualized. And we were able to make pregnancies safe and in the state before we left, and after 8 years in government, we were able to see those children, now in primary school and producing quality babies. And in fact, there was a survey that we conducted on those the first 1,000 babies delivered under this program, seeing their performance in their primary school, looking at their cognitive function and how they would, and we saw that delivery, antenatal care, delivery, and postnatal care has great impact on the performance, of those children in school. So quite exciting, and one is emotional about it, and you feel so good that you can't trade with $1 million. There were quite a number of the reform that were embarked upon at that time. Another one was to see that for every of those children that were delivered, have their full immunization, and getting immunization to reach every ward, reducing the number of children that get crippled by polio, and of course, ensuring that we increase the immunization coverage and reduce the fatality, and those who will run away, such that for the whole period that we were in government, there was no single polio case detected while in government. These were some of the few reforms that we embarked upon while in government. I think the next level for Nigeria in terms of health system is how to really achieve the universal health coverage, ensuring that for every citizen, health care services available for all. It's one of the great move that we should make, to improve our GDP.